British Prime Minister Rishi Sunak refused to answer thrice whether he has private healthcare in an interview. Sunak's approach to dodge the question created quite a furore as patients in the UK struggle to access the crisis-hit National Health Services. Mr. Sunak told the BBC Sunday with Laura Kuenssberg that his healthcare was a personal choice. The reporter suggested in the interview that there was a lot of public interest in Mr. Sunak's decision, but Rishi Sunak avoided all questions on his and his family's healthcare and called it private. He also added that he grew up in an NHS family with a GP father and a pharmacist mother. This is not the first time that Rishi Sunak, who is often made a target of taunts for being too rich, has been asked about his healthcare. A Guardian newspaper report in November 2022 suggested that Rishi Sunak was registered with a private general practitioner practice, or the GP practice, that offers on-the-day appointments and charges £250 for an half-an-hour consultation. It is believed that patients of this high-end GP clinic can request home visits from doctors for which they are charged between £400 to £500, depending on the time of the day. The latest NHS or the National Health Services figures show that most patients have to wait longer for an appointment. NHS is publicly funded healthcare system in England. The figures say that just 41.5% of UK citizens saw the GP the day they made the appointments in September. A further 8% got to visit the doctor on the following day. About 19% of appointments took place between 2 and 7 days after booking, while 13.5% of patients had to wait up to 2 weeks and 5% had to wait more than a month. So while 5% of UK patients can't get a doctor to see them for a month, many question the private clinic services that Sunak might be using. This gains significance since Sunak's government recommitted to a promise by the earlier Health Secretary under Liz Truss that no patient would wait longer than 2 weeks to see a GP. The government also pledged that everyone who needs an urgent appointment would be able to get one on the same day. Sunak, during his New Year message, had claimed significant work towards achieving their goals of making the National Health Service better.
This has had a profound economic impact around the world, which the UK is not immune to. Now, I know many of you have felt that impact at home. That's why this government has taken difficult but fair decisions to get borrowing and debt under control. 3 months ago, I stood at the steps of Downing Street and promised I would work relentlessly on the things that matter most to you. Since then, this government has taken decisive action to back our NHS with record resources to tackle the backlogs, more funding, more doctors and more nurses. I've always been very clear in expressing my gratitude and admiration for our NHS workers and indeed our public sector workers across the world for the job that they do. I've acknowledged that it is difficult. It's difficult for everybody because inflation is where it is, and the best way to help them and to help everyone else in the country is for us to get a grip and reduce inflation as quickly as possible, and we need to make sure that the decisions that we make can bring about that outcome, because if we get it wrong and we're still dealing with high inflation in a year's time, that's not going to help anybody. I don't want to see that. I want to see things get back to normal, and that's why having an independent pay process is an important part of us making those decisions and getting them correct, and that's why we've accepted those recommendations in full.
UK has been struggling in the wake of strikes by public service employees, with its train services, ambulance services and hospitals feeling the brunt of their anger. Employees across the UK economy are demanding salary rise in the face of decades-high inflation, which is currently running at nearly 11% and is spurring the worst cost of living crisis in a generation. But the government insists it must stick to the more moderate increases for public sector workers recommended by independent pay review bodies. Despite the government's insistence that it will not negotiate, polls indicate most people support nurses and to a lesser extent other workers walking out and striking.
So lucky that my husband was brought to this hospital yesterday, so the ambulance was still driving.
I think it has to happen. If the government doesn't doesn't get the point, it's, well, we're in trouble. I absolutely support the strikers, not just because of pay, but because of shortage of nurses. And it's a ridiculous situation whereby nurses are quitting now, going and working for an agency, coming back, and it costs the NHS God knows how much money. I don't understand why the government doesn't take more attention. There's one Tory MP who is saying that, and as I say, they do need more money, but they need more nurses.
I mean, this is the thing, it will have an impact, but the government won't speak to them, so what other option have they had? I think, over the years they've been very understanding, and the ambulance services and the health sector have always, done the best through the pandemic and everything, and I think now is just the time that they should get what they deserve.
The ambulance strike is definitely going to affect a lot of individuals today, and they have their reasons for going on the strike. But at the same time, they've put a lot into the service, to support people during the COVID period, and they will definitely have the reasons for, going on strike. We have a lot of youngsters these days that don't look to work for the NHS in future because they think that NHS are getting low paid.
The nurses' strike that UK saw might prove to be a prelude to another one that may cripple the UK health system. Unions representing both nurses and ambulance workers in the state-run National Health Service, or the NHS, have threatened further stoppages in the new year if the government keeps refusing to discuss pay. The RCN, the largest union of nursing staff, has warned that nurses will take wider industrial action next month if the government, as they say, keeps giving their nursing staff the cold shoulder. Nurses in Scotland, who did not join the two recent walkouts, will announce strike dates early this year after rejecting the latest pay offer by the Scottish authorities. Military personnel had to drive ambulances and perform logistic roles to mitigate the impact of ambulance strike in UK. A sharp rise in COVID-19 and flu admissions in the recent weeks has also put pressure on hospitals, which are also dealing with a backlog of treatment that built up during the pandemic. In the midst of such a health crisis, the refusal of the PM to reveal his healthcare options is proving to be an irritant for many. It just gives more ammunition to the opposition that has been targeting the Sunak government for their inaction and high-handedness on the healthcare workers issue.
In 12 hours' time, there's a nurses' strike. All he needs to do is meet the nurses. His inaction speaks volumes. As ever with this Prime Minister, it's Tory politics first, patients second.
The rest, last year, when everyone else in the public sector had a public sector pay freeze, the nurses received a 3% pay rise.
Mr. Speaker, nurses going on strike is a badge of shame for this government. Instead of showing leadership, he's playing games with people's health.
It's right, if he thinks it's right that pay demands of 19% are met, then he should say so. What's weak, Mr. Speaker, is he's not strong enough to stand up to the union.
This before. They've been forced into it because the government has broken the health system. Ask anyone in the NHS. They will tell you they don't have enough staff. 133,000 vacancies. And there's an obvious solution. Scrap the non-dom status and use the money to bring through the next generation of doctors and nurses. That's what Labour would do.
Mr. Speaker, we're already investing billions more in the NHS. We're already hiring thousands more doctors and nurses.
The issue has the potential to snowball and threaten the Sunak government that saw a discouraging prediction in a recent survey that foresaw defeat in the next general elections for most ministers. Traditionally, most PMs have been transparent about their healthcare. Margaret Thatcher famously revealed in 1987 that she had private health insurance, saying it was vital to go to an hospital on the day she wants, at the time she wants, and with a doctor she wants. David Cameron made a virtue of using the NHS during his time at number 10, while Boris Johnson had claimed that it saved his life when he caught COVID. Maybe Rishi Sunak should come clean as well.